conversations that matter. September is Suicide Prevention Awareness Month. Suicide is the 10th leading cause of death in the United States. Among teenagers, it's the second cause of suicide in the country. Nearly 46,000 people lost their lives in 2016 to suicide. And over the past 2 decades, suicide has risen in some states by 30%. So I want to welcome my guests today. I want to welcome Janet Shedd-Back and Dr. Susan Pollack. She is a pediatrician and a member of the American Academy of Pediatrics. And Tammy Barrett. She is the State Suicide Prevention Coordinator. So thank you guys for joining me to talk about a very important and difficult subject. We recently had a conversation with Janet. Janet is a suicide loss survivor. She lost her son 3 years ago at age 18 to suicide. And we hope you have seen that podcast. She was so gracious to share her story with us. And today we're going to talk more about the crisis around suicide and what we can do as a community, as a government, to help prevent suicide, and talk about some of the warning signs that we may not understand that will help us save our own community. So welcome to you guys. Tammy, I know that you are the expert when it comes to statistics.
Okay.
And that tells us so much. It tells us what a real crisis we have on our hands with suicide in Kentucky, but really across the country.
Yes.
So tell us some of the numbers that stand out to you that really will be moving to us to understand how much of a problem this is.
Okay. Well, I can tell you that Kentucky remains higher than the national average for suicide deaths. And one of the things that always gets me with the data that we have is in Kentucky, based on the preliminary data, we're losing a person every 12 hours in the state of Kentucky to a suicide death. And that's actually an improvement. The year before, it was every 11 hours. And in Kentucky, another staggering statistic is you are 3 times more likely to die by suicide than homicide.
Wow.
And that's kind of staggering because when you turn on your TV, you see homicides. So that shows that we need to raise the questions and the conversation, the awareness.
Mm-hmm.
So that's some of the statistics. It is the second leading cause of death for persons 15 to 34 years of age, and it's the 4th leading cause of death for 34 through 50. So that's pretty significant, because if someone had diabetes, for example, a lot of awareness is raised with that and questions are asked. But when you're looking at a second leading cause of death, and we're not even talking about it. So, that's pretty statistics. The statistics are pretty insightful.
Pretty damning.
Pretty damning.
Yeah. We'll get into this in our conversation, but there's so much stigma around
Yes.
suicide attempts, and depression that I think is a real constraint to us talking about it, and it being a conversation around the kitchen table, like diabetes and heart disease, that kind of thing. What can we do to combat that stigma?
I think when we look at the stigma and we look at the state of Kentucky, I would encourage people to look at their own belief system, to look internally, to see how they feel about it, how they believe about it, and start the conversation. Because it takes one to get that ball rolling. And if you start talking to your family about it, that's what raises that stigma. That's what eliminates that stigma. And that's what will allow people to reach out for help, because if you're in a family that thinks mental illness is not to be talked about, you're not going to talk about it, especially youth. So, I think raising that conversation, looking at your belief system and seeing where your priorities are, is learning about it and saving someone in your family's life important? And if it is, then talk about it.
That's probably one of the most difficult things for men to do, particularly, right?
It is.
And men die 3.5 times
Yes.
more often than women by suicide, right?
That's correct.
And white males account for 7 out of 10 suicides in 2016.
Yes.
So it's even more important for us to have those conversations around the dinner table.
Yes.
I think sometimes if folks, if someone breaks the ice, and that gives them permission to open up maybe more about it. So it really starts with the community at home, right?
It does.
For us to begin the conversation.
It does.
There are some structural issues though too, because if there's a lot of coroners who don't want to call something a suicide because they know that, for instance, if it's ruled that you died of suicide, then your life insurance may not cover your family, for instance. So there are the structural issues like that. And with the same way with youth, a lot of times they'll say, well, I don't want to cause the family any more pain. But what they don't realize is if they won't call it what it is, then they really hamper our efforts to help the next person. We can't help a high school when we don't know that that's the cause and manner that a child
That's so
died
insightful.
by.
Yeah, it's so
And yet
powerful.
You don't want to be harmful to a family.
Of course.
That's the dilemma, I think, that results in an undercount, if anything, too, of the actual number. But maybe we can start to change that conversation too through the table you're talking about.
Yeah.
Absolutely.
I wanted to talk a little bit more about the statistics around suicide. In the LGBT community, around transgender youth. Have you seen a rise in suicide through your work with those groups of young people?
Yes. We have, and there was actually an article released today by CNN. I don't know if you read it or not, but
I
it
did take a look
said,
at it. Dr. Pollack sent it to me.
yes, it's very interesting. It says that transgender males are 4 times more likely to attempt suicide than their counterparts. So, that's pretty significant, and that kind of goes with, that's even part of the stigma. There's stigma around mental illness, there's stigma around being different, and that needs to be part of that conversation as well, because, when you're looking at those statistics, and, you was talking about the deaths rising across the United States. In 2016, Kentucky rose by 37%. So that's huge.
That's staggering.
Yeah, 37%. We did see a decrease in that a little bit last year by preliminary data, but in the LGBTQ community, they already have a risk factor. Just being in that community is a risk factor.
But again, it seems like there is something that could be done, because if the world was a more friendly and supportive place for all people, you figure that people have enough difficulties without attempting to make themselves more, and when people are blamed for whatever situation they're in or whatever person they are, it's not a way to be supportive of them, and that's something that could be done starting with any one of us, like immediately.
Well, I think that community, they often lack family support, they lack spiritual support, and they lack school support because they're afraid to go to anyone.
Yeah, that article, I remember it noting that they're more likely to experience discrimination, victimization, rejection, and it's worse by family. And the youth, the transgender youth that are more supported by their family seem to thrive like their counterparts as well. So it's really about support and about feeling connected to someone. Janet and I were talking during our discussion about being connected and how important that was for folks of any age feeling depressed and alone and having those thoughts. That's sad, and I hope we find ways in our community to help those groups.
Well, when you said about connection, some of what we've heard in reviews of youth who've died is sometimes that connection might only be even a single person.
Yeah.
When somebody dies, often many systems collectively failed, and sometimes just one person. If just one person had talked to that person a little longer, and that's an important issue, I think, for teens, because a lot of people don't really like teens. They think of them as being problematic, and they aren't very patient with them, and they tend to downplay their concerns as being not legitimate. And really, I think that the teen suicide is somewhat a reflection of our failure as a society to support our teens. And just that one more conversation, that one more person. I mean, not in every case, because some people have supportive people, and that's maybe less true in depression, but in some of the kids who are really alone and who don't have good family support and don't have school support, just one person might really make a difference. People talk about that who have decided that life is worth living, and so it seems like that should somehow be within our reach.
Right. Well, we know it's a crisis. What are the precipitating factors that are leading youth and adults to think about suicide as a way out? That's probably not fair because it's but what leads folks to go that route?
You know, that's a really complex question, as complex as the people, you know, that die by suicide. I think one of the leading factors for youth, well, for everyone, but specifically youth, is social media. They never get a break now. You know, before social media was so prominent, you could get away, you could go home, you could turn off your phone, you could go to bed, and now it's Facebook and Twitter and Snapchat or whatever they're into. That's 24 hours a day, and it's so discrediting in a teenager's life when somebody's posting negative things about them. So I think social media is a huge force behind that. I think that access to care is another issue, especially when you get out into some of the rural communities. You know, they may have to travel 2 hours to see a mental health professional. And I think having people trained to talk to someone that's in crisis, there's a lot of training programs out there. One of the ones that we use is QPR, which is Question, Persuade, Refer. And people don't know how to talk to each other. You know, we're kind of in a world of technology now. So, you know, it's rare. It used to be the standard. Now it's rare for a family to sit down and have dinner together. You know, somebody's on a phone, somebody's in front of a TV, a kid's on a game, there's something. So I think that, you know, the families, it's not that they don't love each other, it's that they're not connecting. So I think... It
seems like that's what we continue to go back to, right?
Yeah.
Is that connection.
Absolutely.
Even in my conversation with Janet, we talked about life after loss and how important connecting was for her and her family to support. That seems to be the nucleus of
But I do want
so
to
much.
put a caution there a little bit, because that almost puts the onus on the family and says it's their failure.
Yeah,
but I think
good
that in
point.
fairness, our whole society is so family unfriendly
Yeah.
that it's really hard for people. We're not supporting families in doing these things that we know are healthy. You know, when people are working 2 jobs or 3 jobs,
Yeah.
or, you know,
In spite of the connection sometimes.
right. I mean, sometimes they're
like
struggling
in
to
Janet's
have
case,
those
it
connections.
happens. Yeah.
Yeah,
But-
and it's, I mean, for clarification on that, in many of the cases, most of the cases, it has nothing to do with what the family did or didn't
Right,
do.
right.
It's a shift of cultures right now.
Well, access to
Yeah, and when you do
more
have,
connection, perhaps.
Yeah, and you do have people working 2 jobs, and you have turnkey kids. So it's not, like I said, it's not that they don't love their children.
Right, of course.
It's just that connecting. And then, you know, we've got this huge opioid crisis. You know, the access to means
People who basically don't
is
have any
huge.
families.
You know, it's you
Too.
know, it's like Tom's access to a gun. You know, access to a gun is so easy. Access to drugs or alcohol is so easy.
Yeah.
And you know, you take someone, and they call it that, you know, that triad. And you take somebody in crisis, and you take any kind of a substance, and then one thing going wrong, and then that's where you get the boom. You know.
I think that we also are seeing, like you said, a number of teens who don't have a good family support structure, and the reality is that right now our resources are so overstretched that if we see those things in a toddler, they get help from outside, and when we see that in the adolescents, no one helps. And that's what we're seeing. Some of the kids really just have given up their hope because they don't have anybody looking out for them. And that's, you know, that's something we need to do better on, I think. I mean, that's one thing. And I also think that people get tired. I think for people with depression, like, people get tired. I think we underestimate how much work it takes to be okay.
Yeah.
And so we need to do something to support them, because they're just so tired of fighting that they give up too.
And we can I sincerely believe that to build resiliency, we need to start with children. We need to start young. And there is a Kentucky Initiatives for Prevention, it's KIP, and they do a survey through schools in Kentucky. And they do a survey with 6th, 8th, 10th, and 12th graders. And I can tell you that based on the survey that they do, and this is straight from the children, and I'll just use 10th grade for example because I've got that embedded in my mind right now, but 10th graders reported, almost 25% of them reported severe psychological distress at home. And just that's a quarter of the children that are reporting severe psychological distress. Well, it just says
Or just
severe
generally.
psychological in
Yeah.
general, but that might be school, it might be the LGBTQ student, it might be the black student that's in a primarily white school or vice versa, or it might be a Hispanic student or an Asian student. So it's just kind of, you look at those minorities and they're dealing with so many stressors, and just being a kid today is stressful.
Yeah, that's what I was thinking, like when you talked about connections. I know in our house, like the first big shooting in Europe that where the attack was on a concert that attracted primarily children. And one of my children was just so amazed that someone would intentionally target children. And I think that but then the way you build resilience, I think, is if you can start to help children build community in smaller ways where they do feel there's a community, then maybe the impact of those things is less. So supporting things that do build community.
And that starts in our homes, in our public schools, our private
Yes.
schools, in our community networks, organizations.
Yeah.
I know you work primarily with youth, but I wanted to talk about the crisis around veterans and suicide too. Can you speak to that?
Yes, I can. And I work with all ages.
Okay.
Our grant focuses on a specific age range,
Okay.
but we work with all age
Okay.
range. But with the veterans, I can tell you that on the Department for Veterans Affairs, I looked at their data, and they had, the last data that was on their website was 2015. And it said that 127 veterans died in 2015. And of the 127, 120 of those were male. And it was primarily, I think it was 34 through 55 was the biggest age range, that they died by suicide. And I think veterans, I don't want to say more so, but that's kind of the way I feel. They have a stigma that's even heavier because, they was in a service that trained them to take care of other people. Other people come first. And, if you're hurting, and I don't want to say suck it up, but that's kind of, a veteran explained it to me this way. He said, we have a regiment and we're told to get up, we're told to suck it up, we're told to be tough, we're told to be men or women of the service, and, we're to protect others. That's our primary goal. So when they get out, they have to readjust to a world that was different than they left it. And their families are different. Their families have continued for years sometimes without them. So, they're trying to adjust, and most of them have PTSD, and that's one of the biggest driving forces for suicide in veterans. And then, when you look at the access to care and you look at housing and just financial means, a lot of times they just can't make it on what they draw. And it's very hard, and I can tell you that suicide rate is rising. And I can also tell you that there's a lot of research that's showing that the children of veterans are also at higher risk.
Are we getting the kind of federal and state dollars to fund prevention measures or provide education
No.
to folks in the community, our school systems?
No.
I think for any type of research, we always need more money. I mean, always.
One for the care too.
Yeah,
I mean,
we
the fact
do.
that there just aren't
For
enough.
prevention, for postvention, we always need more money. Kentucky could definitely use more money because
Have there been cuts in the budget?
there have been cuts in the budget. The prevention side of that has not seen the
Sure.
prevention side that I'm working with, because my efforts are primarily funded through the Garrett Lee Smith grant, and we do have some state general dollars, but I was very fortunate in that my budget was not cut as much. But
Is that a federal grant?
yes.
Okay.
So
But community mental health has seen cuts.
community mental
substantial
health has
cuts.
seen cuts.
And that's the
yes.
system that's supposed to be the safety net, in rural areas and for
Yeah.
people who
And
don't
when you
have
talk
means.
about
That's true.
suicide being the number 2 cause of death
Yes.
for teenagers and young adults, and we're not talking about it, we're not funding the kinds of programs that will offer preventive measures, That's alarming.
It's very alarming.
And I would also just add, in terms of private insurance, it's very difficult to
It's very
get
difficult.
coverage, continual coverage for mental health.
You
usually
get so
have-
much,
You
right?
get
And
so
then you
much,
get cut off.
if you even,
Right.
and the amount that you pay is, your copay is going to, or not your copay, but the amount you're going to owe is going to be a lot, and that's,
Well, and
you know.
then again, some other populations too at risk. I mean, farmers, in our state and in the nation are really, and older farmers are really facing some really huge pressures. But there's been a lot of discussions about veterinarians and physicians have very high rates. I mean, veterinarians was a bit of a surprise, but it really probably shouldn't be, because again, the creatures they treat die, and they have a lot of distress that they just have to go on and see
And
the
they
next
also serve
patient.
the farmers.
Yes.
So, when the farmers suffer, then their business suffers, and that's
Yeah.
and farmers is an increasing group also.
Is it?
The deaths are
Yes.
increasing in farmers
I mean,
as well.
specifically in our state at the minute, just even the dairy farmers, the fact that some of the decisions made by large corporations have really abruptly affected dairy farms that were barely hanging in there. And so people who for generations, so it's not just even, it's your livelihood, but it's also your way of life. And it's your way of life for your children. And now,
And when that gets ripped away,
right,
you feel
what do you do?
there's no answer.
Yeah.
And also for physicians. So I guess it's like lots of groups, really. The other issue too is that about care is that if you seek care, there is the stigma. This comes back because, for instance, if you go to apply for a medical license, it asks if you've ever been hospitalized for treatment of, I think, psychiatric disorders and or substance abuse. Well, isn't it wiser to have someone who's actually sought treatment than who's really struggling and hasn't sought treatment? But yet the structural things really punish you for actually doing that. And so people will go to great lengths to actually find that care in ways that are anonymous.
Just adds to that
But-
stigma again, right?
Yeah.
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 It seems to be one of the biggest constraints.
And there is really also, at least for children, a real shortage of people. There is a nationwide shortage of child psychiatrists, which is a huge issue, so that the care people get, may not be as educated about the needs of that particular age group. In our state, we have really an amazing mental health program that covers every county. But in some of the rural counties, if you're covering people 0 to 90, and you are one person, and it tends to be young people freshly out of training, so we need to have more training available, and people have welcomed that everywhere it's been offered, but more training, so you need more staff to do more training
need more
for
staff.
mental health providers too.
That's true.
I just wanted to say one quick thing too about the, while the internet has been such a negative in many ways, it's also on occasion we have saved people because of their connections on the internet sometimes, and also there are kids who are not comfortable talking to a person who will look up things or will have a chat. So it's such a double-edged sword for us because it's definitely a precipitator of a lot of nastiness that can lead to suicide, but yet on the other hand, sometimes it's helped us save people.
Yeah, I see that. What have we learned through suicide prevention research?
What have we learned? I think we have learned that the culture has shifted some, and I
Drastically,
think
right?
drastically, yeah. So the culture has shifted. I think that, gosh, I don't even know how to say
so
it
that
gently.
it is possible? Is that what you mean? Or do you
well,
mean it's making...
Anything's
And the
possible.
culture is a precipitating factor.
Yeah,
Oh, okay.
it is.
Yeah.
It is a
Yeah.
precipitating factor. So I think that like you was saying, it's not that they don't care; it's that they're doing two jobs.
Yeah.
it's
People are just spread thin. Even,
they're spread
even
very
kids
thin.
are spread thin between
They
school and
are.
extracurricular, academic and sports activities. The high demands that come with being a youth now is just
It's
crazy.
tremendous. Well, I think one of the biggest things that we've learned from my perspective is that it takes a village. It literally takes a village to get through this epidemic, and it's, I know I work closely with the Kentucky Department for Education and school safety, and they're on board with this. They know what's going on, and, so they send out crisis workers if there's a crisis at school, so they're very on board with this. But we have to unite as agencies, as community people, as families, as emergency rooms, everybody has to unite and has to work together to kind of pass the torch on, in the journey, because that's the only way that we're going to make time and dollars stretch. I mean, it really, truly does take a village to beat this.
And if we started earlier, it would be helpful
We
because
do need to
we would
start
probably
earlier.
need less resources if we could actually start earlier
Well,
before things are so difficult for people.
Yeah, and I was listening to Janet speak, and I heard another mother speak about 2 weeks ago, and through her tears, one of the things that she said was she lost a daughter recently, and she said, if my little girl would have had diabetes, if she would have had a heart condition, if she would have had a broken leg or arm, every teacher would have known. I would have known what to do. Yes. I would have known, and she could have potentially been saved. And she said, but she had a mental illness. And the mother didn't even know she had a mental illness. And then she found out after she lost her daughter that there was mental illness throughout her family that no one had spoke about. No one had spoke about. So, it's just raising these conversations. I know I keep coming back to that, but, uniting and raising these conversations, it's going to save people. It's going to save kids. And if we start this in grade school, if we start this before grade school, if we start in the hospitals, like Janet and I were talking, when a newborn baby is there. I just had a granddaughter born a few days ago.
Congratulations.
Thank you. She's beautiful, by the way. But had they said, okay, do you have guns in the home? Because you now have an infant. Yes. What are you doing about guns? They don't, if they would cover guns, if they would cover safe sleep, if they would cover what these new parents need to know. Because, and this is my son, and I love him dearly, but, when you're looking at these young parents, a lot of them are still in their 30s and playing games. You know what I mean? Right. And so, where we were 30 and we were working and having a full-time job, they come home and they're on a gaming board. Right. So their reality is a little bit different than ours. Somebody needs to teach them. Somebody needs to say.
Go ahead, Dr. Pollack.
Well, the other thing too, that if we could start in elementary school, kids know that if your tooth hurts, you go to the dentist, and if you have the flu, you go to your doctor, and so, that you need feelings need checkups too, as a program of the Academy of Pediatrics. But it's true, and if you could know that, well, if you're really sad, you go and see your counselor, and it should be on an equal plane. And you can build that in your house, but it's not so easy. It takes a long time, and to really give kids the skills to do that on their own, to know that if they have a problem, try to deal with it yourself, be resilient. But if it's bigger than you are, then it's okay to ask for help.
I think I don't think there's anything more we could say that could drive home more of an impact than to start the conversation. Yes. And I don't want to play on conversations that matter, but that's why we are having these tough conversations. And you three have seen it in your lives so significantly and understand it. And for the audience, whoever hears this podcast, I hope they will hear what each of you are saying and go home and talk about it with your kids. Yes. Go home and talk about it with your significant others. Absolutely. Go to work at the lunch counter and the break room and bring it up. Because you never know what colleague might be suffering, or what colleague's son might be having a hard time, and they may feel shame because of that, and that stigma that's so thick in our society. And maybe it's just that one voice. I keep looking at your
be the
badges.
Voice.
Be the voice. You can be the voice for someone you don't even know.
Yes.
And Janet is a loss survivor, and for us to hear her story and how important it is to talk about it, and she's asking us to talk about it, so that it doesn't happen in our families, in our communities.
And I would say too, it is so common. I mean, you had mentioned that you had a friend who died by suicide. Yeah. You've had experience in your life, but no one thinks it is when it happens to them. And if we could just be open about that, people would not feel so alone.
Yeah, absolutely.
So maybe it's also not just, we've talked a lot about talking about it, but the thing we haven't really talked about is also just listening, because what we hear too is that when kids do talk, people sort of blow them off. That they don't believe it's real. You had mentioned it earlier.
Yes.
When someone brings it up or talks about it, or says that I'm thinking about it, take them seriously. Whether it's a 13-year-old young girl or a 35-year-old man that's just in despair.
And every time every time
Yeah.
they say something.
Mm-hmm.
But also, I think just giving people, this comes back to the connection. I think having the conversations where you listen enough to hear what might be on their mind,
Mm-hmm.
so that you have an opportunity if somebody's thinking about talking,
Right.
to actually, to have a receptive listening so that you encourage the kind of
To
communication.
be present when they are talking.
Yes,
Right.
yes, and not on your phone.
Yes.
It's the adults on
Yes.
phones.
Yeah.
There's been
Yes.
some interesting stuff lately about how it's adults who need screen time limits because
Yeah.
they're
And I
not paying
see that.
attention to
That's
their
true.
kids.
Yeah, I've self-imposed that on myself at times, so it's true.
And when you are listening, listen with the intent of listening, not of responding.
Mm-hmm.
And the Louisville Health Advisory this week, because it's Suicide Prevention Week, they're actually trying to set a new world record for the most QPR trained that
Oh,
they
wow.
can this week. So
Tell
that's
us
pretty
what
significant.
QPR is.
QPR is question, persuade, refer, and what it is it's a gatekeeper training that anyone in the community can take. It takes about 90 minutes. I can train you. My team trains. There's trainers across the state. I would be happy to hook you up. Anybody that would like to take it, but it teaches you to recognize the warning signs. If you're talking to me, you would recognize that I'm distressed or that something's going on.
Mm-hmm.
It tells you how to talk to me and question and listen. And as important as talking is asking the appropriate questions. If someone is thinking about it, you need to say, Tammy, you seem very distraught lately, and I need to ask you this. Are you thinking about killing yourself?
Mm-hmm.
If you say something like, are you thinking about hurting yourself, or you're not going to do something stupid, are you? That's some of the worst things that you can say, because if I'm contemplating suicide and you say you're not going to do something stupid, well, that just drives me down another peg. That just puts me a little bit farther down. And people that die by suicide, or most of the survivors, they're not trying to hurt themselves. They're trying to end a pain. So it's very important as to how to ask that question.
Say that again.
So, it's just very important how you ask
Yeah.
that question, because the people that have survived suicide, they want to stop the pain. They don't.
Yeah.
They don't want to hurt themselves. They
Right.
want to end the pain.
We look at it so differently in just common society that oftentimes they're just seeking attention,
Yeah,
and we downplay their seriousness because of that, or they're cutting themselves because they want the attention.
Yeah.
And
What I hear a lot is like, well, he has all this, why would he do something like that? He's got everything or whatever, and it's like, that has nothing to do with
so
people's,
irrelevant, isn't
when the
it?
world feels so gray that
Yeah,
you
it
can't
makes sense.
see
Yeah.
any hope.
we and Jen and I talked a little bit about this, the neurobiological component to this, really.
Yes.
And I don't know if it's a fair question, but are we predisposed neurobiologically to suffer from depression or suffer from that kind of pain? Or is it a combination of that and culture and stressors in life? Can you speak to that, Dr. Pollack?
Well, they're definitely, I don't know whether it's neurobiological, but there certainly seems to be a pattern that if your family has a history of people who have died by suicide or tried to, then you definitely are, by definition, at higher risk. And certainly certain types of mental illness can also run in families. So like many things, if it's an interaction of the environment and your genetics, there seems to be something that would say some people are at increased risk.
Right, much like diabetes. Diabetes runs in the
Right.
family.
But then the question
So-
becomes what happens, how that goes afterwards might depend on whether or not you get treatment and whether or not you are in the middle of those stressors. But yes, if you know that you come from a family where that, then just like diabetes, you have to be alert to maybe getting extra care because you would if it was diabetes. And
Right, exactly. Tammy, talk some about the programs that you're working on through Kentucky. Some of the state programs that you're working on as far as prevention, and then I want to segue into what we can do as a community to be involved in prevention. I know we've talked a lot about basically just having the conversation and opening up and breaking that ice, but other ways we can be involved in the community to be proactive on that. But let's talk about some of the programs that your office is working on.
Okay, we're working on a lot, and I'm sure I will forget some. Obviously the QPR, we're working on that. We provide assist trainings, and that's just that's a little bit more in depth than the QPR training. So there's a lot of different trainings that are suicide prevention, and they're geared toward either behavioral health professionals, community members, treatment, people. So it just kind of depends on what you do for a living as to the training that we could provide for you. And we can provide those trainings for little or no cost. The QPR training is completely free. We promote school curriculums. There's several out there. The one right now that I have monies in the grant, or that we have monies in the grant to cover, is Sources of Strength. And Sources of Strength is a resiliency program that schools can adapt into, and it has peer leaders in it. And it's a very successful evidence-based program, and it changes the entire culture of a school. And I recently had a counselor tell me that she had been a counselor for 14 years, and after this got implemented, like on the third day, just what she saw as a relief in the students was the single most emotional day of her work career.
Wow.
Because she just saw kids coming together. As a result of that program, we also had we have a lot of success stories, but recently one to where a bus driver recognized the warning signs in a student and did what he was trained to do through this program and saved this child's life. So we promote things like that in the schools. We work with the Department for Education and School Safety, and we try to make the schools as safe as possible. They're doing everything they can on their end, but again, I'm going to say it takes a village because different people have different skill sets. So, we're working with a lot of community agencies. We work through the local health departments. We attend reviews of deaths by suicide, and we're learning a lot of specifics to communities, and we're networking and making a safety net that's very specific to their community, because it's different. If you have a death in eastern Kentucky and one in northern Kentucky, you're going to have different circumstances. So we go around, we do that. We provide technical assistance to schools. We work on their policy and procedures. We always, in almost everything that we do, we incorporate substance use or alcohol use in that, because that's often such an underlying factor. And in many of the deaths, most of the deaths, there's some type of substance use or a pattern of. So we always address that. We do the technical assistance, where we work with the policy and procedures, like I said, and it's what we're trying to get them to do is have something in place so that if a crisis hits, what do we do? Too often they'll say, well, we'll call you, or we'll call the emergency room or the EMS, we'll call somebody, but that's not sufficient, and that time is crucial. So we're working with the schools on that. We are going out, we've trained Ruritan clubs, we've trained Rotary clubs, churches, a police department. Oh my gosh, I said the church, Department of Agriculture has stepped forward, we're training them. We're just doing trainings everywhere someone will listen.
If someone hears our conversation and wants to get in touch with you in your office, how can they do that?
The most effective way is email, and my email is Tammy, Tammy, s.barrett@ky.gov.
Okay. And we'll put that up on the screen too.
Okay.
When we edit this out, so folks can have access to you and find out what programs are available for them, and maybe what they need as far as your programs are offering.
Okay. Yeah, we have so many. We're networking. The big word with us is we're networking. With the coroners, the health departments, the Department for Public Health, the police officers, the ERs, EMS. It's just a community networking that we're doing.
Well, we've talked some about what we can do as a community, begin the conversation. Can we talk a little bit more about warning signs and what folks may be able to notice in youth or adults that may want them to break the ice and say, hey, how are you feeling? What can you say about that?
I think with warning signs, they're so varied. But one of the first things to look for is a drastic change in personality. If you see me every day and I'm always real bubbly and then I'm real down, talk to me, see what's going on. Or vice versa, if I'm somebody that never smiles and then all of a sudden I'm just ecstatic and life is wonderful, talk to me. Because something causes that change in me. So if you see a drastic change in personality, And the same with sleep patterns. If you're talking to somebody that sleeps all the time and all of a sudden they're not, or vice versa, please talk to them. You know, there's a lot of underlying risk factors, like we talked about the LGBTQ community, if there's been a previous attempt, a family history. So anybody that's got any of those things going on, and you start noticing stuff like reckless behavior, driving too fast, getting tickets, fighting at school. And you know, one of the things, bullying, you know, the victim of the bullying is obviously at risk, but what people don't understand is the bully themselves is also at risk, because that's also a drastic behavior. So, you know, look for risky behaviors. A huge warning sign is if somebody starts giving away prized possessions. You know, if I collect miniature Harleys and all of a sudden I'm like, do you like that, Susan? Would you like to have that? And I start giving away something that you know is valuable to me emotionally, that's a huge warning sign. A pet. If you start kind of passing out, pets are huge. We have actually had people say, my pet has kept me from dying by suicide, because who would take care of my pet? You know, so, you know, like I've got a little dog named Godric, and my counterpart tells me, I know you're in trouble if you ever say somebody needs to take care of Godric. Now, she don't mention my 7-year-old son. She says, you know, but that obviously would be one. But, you know, so if somebody starts passing off a responsibility, you know, that's a warning sign. Gosh, moodiness. I mean, there's just so many. It really depends on the person. Skipping school. You know, if you start seeing an adult and, you know, if you know somebody personally, and if I know you personally, and all of a sudden you start saying stuff like, man, I can't make, you know, my mortgage payment, or I can't make my rent payment, I can't make my car payment. You know, talk to that person, see what's going on. Because when people start losing things, that's when they go into panic mode. You know, if you see self-injury, you know, that type of behavior, that's not an attempt at suicide usually, but it's a huge warning sign. You know, especially youth, they cut, they burn. You know, if you see something like that, talk to that person. It's not just youth, adults do it as well. So, you know, that's another warning sign to look at. So any of those behaviors, and there's many more, and I would be happy to share those, you know, if anybody reaches out for that. But those are all warning signs that you need to look for.
We'll provide some information on our website about that too, so that if folks are watching the podcast and want to link over to the website and learn more information about that, I'll get with you and find out what the best link to that is.
One thing as far as the teens that seems like it's important too is that I think a lot of teen change in behavior gets chalked up to, oh, it's the terrible teens. So, and it gets dismissed, and it's not seen as a sign of distress. And it's easy to understand why that happens, but I think that I would caution people to be careful about that, because sometimes it's, you know, the terrible teens are not all that common. So if you're seeing somebody do that, really huge change in behavior, I would worry about it.
And even to back down from that, I just kind of want to say this also. A lot of people think that they don't start thinking about suicide till they hit teenage years, and that's not true. There was a child as young as 5 that has died by suicide in Kentucky in the past year. So, you know, and we've had a lot that's been around 9 years old. So, you know, just because your child is young, if they start exhibiting any of these behaviors, take them serious.
Something that I would like to bring up and highlight that all of us have a connection to, this is how I met Dr. Pollack, and Janet works directly in this arena too, is safe storage in the home with your firearms. And Dr. Pollack, you may be able to speak to this more eloquently than I, but youth that commit suicide oftentimes will use a firearm, and the access to that firearm is key to their impulsive behavior at times, right? Can you talk a little bit about that and how important it is? And I'd like to get Janet's perspective on that too, because she works a lot through Moms Demand Action around that initiative. And we are talking about that at Conversations That Matter too. But speak to that and how important it is.
Well, I think it's so important for 2 reasons. I mean, there are 2 sets of kids. The kids who just had a really bad day at school and come home and there's a gun sitting on the kitchen table might not have thought about dying, but the means are right there, and they might in 10 minutes have thought it wasn't such a terrible day, but when the means is right there, maybe they don't get that 10 minutes. So they are the impulsive ones, but it's also true that in Kentucky, so many households have guns, and if you have any teenager, that increases their risk. And if you have a teenager with depression, that really increases their risk more. And it's very difficult to get people to give their guns to someone else for a while. But at one of the things that we did one of the places we taught, one of the veterans specifically told me that he agreed with that thought, even though he now has guns, but that he gave someone else his guns for like 2 years when he didn't feel like he was a safe person to have his guns. And I think if we could get more people to at least store them safely, which, and most people think their kids don't know where they are or think they don't know how to get the key, but that's really not true. So if you store them even with the ammunition separate than the gun and locked up, it's going to take some time, and that time might save somebody. And again, this issue that so many people who try once might never try again. So if you took away the lethal means, they would be less likely to actually die, and they would have an opportunity to live to
Right.
continue living.
I think we mentioned it during our conversation, Janet, but I believe may have been in that article from today, that upwards of 50 to 60% of suicides, and I cannot recall what category, are impulsive. And that certainly can speak to that.
But it's interesting because sometimes, like, I've seen reports where a family member will say, "Oh, it's impulsive. I had no idea. We had no idea." But when you actually look, in most of I think the actual number of impulsive ones is probably far less, because when you actually look, there often were warning signs, but it wasn't comfortable for people to believe them, or the child had contact with different people who all maybe saw some piece and it wasn't put together. But I think I don't know, I think the impulsive gets overplayed, but the access in people who are if you think the huge numbers of kids who are considering it would suggest that very few guns should be out unsecured, because lots of kids are thinking.
Right.
Correct. And we've had, when we work events with Moms Demand Action, we'll have many gun owners come up and say they agree with our safe storage program, that if you own a gun, you should be responsible for storing it safely. And there are many easy ways to do it. One of them is a biometric safe that you can open very quickly with.
I have one of those.
Yeah. So if you're worried about a burglar or whatever, you're able to have very quick access to it, but your child or someone else does not.
Right.
As well as gun locks, which are relatively inexpensive, and you keep the key on you.
Yeah. And thanks to Tammy, we're going to offer some gun locks through Conversations That Matter. So we'll have some information about that on our website as well.
I just was going to say, in cars, I think in our state, what I've seen is a lot of people who are very good about their concealed carry permits and where they store their guns in their house, but they get in their car and they're like, "Oh, I didn't even think about that." And so in our state, we've been lucky, but nationally, that one year that we had all these, and even in our state, we had a child in Ashland find a gun on the front seat and shoot somebody or herself, I think, inadvertently with it. So making sure that in cars, you don't leave guns where kids can access
I want to talk briefly about what we can do legislatively. And Conversations That Matter is apolitical, nonpartisan, but it's important to know what candidates think about gun access laws and how important it is to change the background check laws. And what are we looking for legislatively that could really impact this? If we talk to someone running for office and ask them, what do they know about injury prevention, suicide prevention, and what kind of legislation that they potentially could write a bill for, what are we looking for from the government besides more funding?
Well, I mean, from my position, I have to stay kind of in the center of that, but from my position as a mother, as a human being, I would say I would like to see the gun laws changed. I would like to see more background checks done. We have the Casper system that can say you're seeking pain medication. Why don't we have a system that says you was seeking, you was suicidal last week, I'm not going to sell you a gun? Why do we not have a check system like that? So, I would like, me personally, I would like to see the age raised. I think
Yes.
that would be a question that I would ask. If I can buy a gun, but I can't buy cigarettes or alcohol, there's a problem.
Right.
That whole system to me just needs revamped. But I think to raise the age, I think background checks, and I think to wait till those background checks come in, and I think to strictly regulate those. Alcohol's regulated, tobacco's regulated. Why is there not a more strict regulation on guns?
Totally
And
agree.
it's just, it's a little scary to me.
Speak to that,
Yeah.
Janet.
Well,
I know you're working through Moms of
yes,
Inaction, and
and so
they're
from my personal viewpoint, I just find it appalling that you can buy a gun at 18. It should be 21. You can't have alcohol legally until you're 21. Why isn't it the same for a gun?
Mhm.
So that would be one thing.
Mhm.
I would agree also with expanding background checks to include gun shows, private
Yes.
sales, things where background checks are not now required.
Mhm.
And red flag laws have been passed by some states. I'm not sure about the evidence on that yet. Do you know?
No, I don't know a lot about that. I know just enough to be dangerous, so I'd rather not speak on that. So.
But just some way to disrupt access to guns by someone who is harmful to themselves
Yeah.
or others.
Mhm.
Well, there was also a proposal that people with domestic violence
Mhm.
convictions should not be eligible to purchase guns.
Mhm.
And in our state, that's like the number one way that women die who have had abusive relationships. So
Mhm.
that's important. And I think the other thing that came out just today was a study that looked at semi-automatics and the fact that, there still is this debate about, guns are useful for hunting, they're useful for animals in some cases, they're useful for, defending yourself possibly, but who really needs one that's designed as a weapon of warfare and to kill multiple people in rapid rounds? And so the other option was to restrict the sale of ammunition to amounts that seem to be reasonable for what people mostly need them to do. Both those things have been proposed.
And I believe, isn't California looking at tracking ammunition
Yes, I think
as
so.
well, which is another way of approaching that problem.
I know I've been told, we had this discussion that there are people who really like to go out and, I think it's clay pigeons, but I'm not sure, but who really want to be able to have semi-automatics for sport shooting. But I think when you weigh the right of people to stay alive versus the right of people to have anything they want to do, one might at least consider whether, the ban on semi-automatic weapons that are designed for warfare is maybe a reasonable thing to contemplate.
So it's important to talk to candidates and your legislators about this issue. It goes
Absolutely.
back to starting the conversation again. And there's so much we can do in our personal lives, at the lunch counter, at the dinner table. But when it comes to needing funding, they hold the power. So it's important that they understand the impact. And when you're talking about teenagers and young adults being the second leading cause of death, it's so important that they understand the impact of that. So talk to your legislators and your candidates.
Well, and also that they understand that, developmentally, education is not enough. It's not a substitute for securing your gun if you own one.
Right.
Because you can't expect your child to do anything else. I mean, yes, you want to train them and educate them, and yes, you should have expectations. But you also know that at 2 and a 3 and a 4 and even a 5,
Yeah.
they aren't going to reliably follow those. And just like you wouldn't let them run out in the street, where the stakes are so high, that the danger is so high,
Yeah.
is probably not a good place to
I
rely
think
on
we could
only
argue,
education.
for so many reasons, safe firearm storage in the home is of the utmost importance, from not just accidents or theft, but especially suicides.
Yes.
So it's a good reminder for us to reconsider that if we don't have our guns stored properly. I want to close with talking about the impact of suicide on families. And Janet and I have talked about this some, and she can speak to this as a loss survivor and how it affects communities and how you really build resilience around that. I have so much respect for you, Janet, for allowing and trusting us with your story and sharing that with us and the audience. I'm humbled by that, and speak to that a little more. I know we spoke earlier, but talk about that.
Before I do that, I want to quote a statistic that Dr. Julie Serrell, who's the president of the American Association of Suicidology, she did a study that showed the impact, the range of who is affected by one suicide is much broader than we might think. I think it's 135 people are directly affected or touched in some way by a suicide. So it's a massive problem. It's not just the direct family members.
It's not just your household.
No, it's huge. You know, so Tom's death affected many more people than I probably even know about, because I don't know all of his friends. But as a family, I mean, it's devastating. It just rips you apart. It is something that I think we'll never be the same. I mean, we will never really recover from it. We will go on and things will be different, but it's never going to be the same, and you can't take that back.
Yeah. So important. How do you build resilience?
How do you build resilience? I think you start by seeing people and recognizing them as individuals, and that by teaching that it's okay to not be okay.
Yeah.
You know, it's okay to have a hard day. You start when they're young, and you do what you have to do.
We shift the conversation, we shift the culture.
We shift it all, and you know, do what you have to do to get rid of that stigma, because that's what is preventing people right now in the state of Kentucky from getting help. So start young, be consistent, and don't give up. You know, just keep going.
Yeah.
I think involving kids in caring for other people, you know, giving kids at an early age even some little role in their community or in their family, some role that contributes, because then they feel a part of something too, and perhaps that
be a part of service somehow. I think that's a great idea.
You know, there's a quote that actually come from a Netflix series, and it said, if we could look inside each other and see what's inside our hearts instead of what's on the outside, we would treat each other with much more respect and much more kindness and much more love.
Yeah.
And I think that's true. And I think that we can start just as human beings. We don't have to be the same political party, the same faith. You know, we don't have to be the same color. We're human beings.
This is a human issue.
It's a human issue.
Just like gun violence, it's a human issue. Immigration is a human issue.
It is.
Suicide loss is a human issue.
It is.
So I will close with saying we are honored to have you guys give us your time and talk about this issue. I think the biggest takeaway for me tonight is start the conversation. It's such an important conversation that matters, and I think having you guys out in front leading that conversation for us and empowering us is a real gift to our community. So thank you, Tammy.
Thank you.
And thank you, Dr. Pollack. Susan.
Thank you. Thank you. Thank you.
She always makes me call her Susan, but I just can't.
And I'm honored to be here with these people.
Yeah,
Thank you.
and thank you, Janet.
Thank you.
And I encourage all of our listeners to talk at the dinner table with your families, talk at the lunch counter with your colleagues, and talk to your kids. Start the conversation so that we can shift the stigma away from mental illness, from depression, and talk about how important it is to stay connected. So we will have some information on our website and social media. So if you have any questions, reach out to myself and I can connect you with our panel here. I do want to share the Lifeline number, and we'll put that up on the screen. 1-800-273-TALK. It's available 24 hours a day.
Yes.
And don't be afraid that you're going to take up time if you need to talk with someone. And Tammy, you told me that the text suicide prevention line is 741-741. I think sometimes it's easier to kind of shield ourselves behind that phone, and if you don't have the courage to talk with someone, You can text 741-741 from your mobile phone and get an expert on the other side that can give you some time and chat with you. So thanks again to our audience. Please share this podcast. I think this is one of the most important conversations that our community can and should be having, and we appreciate your time. Thank you.